Good evening and welcome to Tucker Carlson Tonight. Here's a very simple question. How many Americans have died after taking the COVID vaccines? That's not Americans who've been killed by the virus. That's a huge number. It's how many Americans have died after getting the vaccines designed to prevent the virus. Do you know the answer to that question? Do you know anything about the downside? We know a lot about the upside of vaccines. We've been completely in favor of vulnerable people taking vaccines. But what about the potential risks? You'd think you would know more about that than you do. We talk a lot about vaccines constantly, not just on this show, but in this country. Joe Biden was on TV yesterday talking about vaccines. He wants you to get one. Everyone in authority wants you to get one. In fact, you probably already had your shot, and good for you. If you haven't had your shot, you're under enormous pressure to get your shot. You understand that soon you may not be able to fly on commercial airlines or go to work at the office or send your children to school if you don't have the shot. Meanwhile, the social pressure is enormous. Friends may have informed you already that you are not welcome at their parties or their weddings if you haven't been vaccinated. So there is a lot of pressure to comply. At some point, you probably will comply. It's just too difficult not to be vaccinated in this country. But before you do comply, ask yourself, do you know anything about the potential risks? Probably you don't know much. We assume the risks are negligible. Vaccines are not dangerous. That's not a guess. We know that pretty conclusively from the official numbers. Every flu season, for example, we give influenza shots to more than 160 million Americans. Every year, a relatively small number of people seem to die after getting those shots. To be precise, in 2019, that number was 203 people. The year before that, 2018, it was 119 people. In 2017, it was a total of just 85 people who died after getting the flu shot. Now, every death is tragic, obviously, but at big picture, we do not consider those numbers to be disqualifying. We keep giving flu shots, and very few people complain about it. So the question is, how do those numbers compare to the apparent death rate from the coronavirus vaccines now being distributed across the country? That's worth knowing. So we checked today, and here's the answer. And these numbers come from the same set of government numbers that we just read to you from. Here they are. Between late December of 2020 and last month, a total of 3,362 people apparently died after getting the COVID vaccine in the United States. 3,362. That's an average of roughly 30 people every day. So what does that add up to? By the way, that reporting period ended on April 23, and we don't have numbers past that, not quite up to date. But we can assume that another 360 people at that rate have died in the 12 days since. So you put it all together, and that is a total of 3,722 deaths. That's almost 4,000 people who died after getting the COVID vaccines. The actual number is almost certainly higher than that, perhaps vastly higher than that. The data we just cited come from the Vaccine Adverse Events Reporting System, VAERS. VAERS is managed by the CDC and the FDA. VAERS has received a lot of criticism over the years, some of it founded. Some critics have argued for a long time that VAERS undercounts vaccine injuries. A report submitted to the Department of Health and Human Services in 2010 concluded that, quote, fewer than 1% of vaccine adverse events are reported by the VAERS system, fewer than 1%. So what is the real number of people who apparently have been killed or injured by the vaccines? Well, we don't know that number. Nobody does, and we're not going to speculate about it on this show. But it's clear that what is happening now, for whatever reason, is not even close to normal. It's not even close to what we see in previous years with previous vaccines. Most vaccines are not accused of killing large numbers of people. The Menveo vaccine, for example, is given to people around the world, often children, to prevent bacterial meningitis. In this country, only one person died from that vaccine in the entire period between 2010 and 2015. One. So compare that to what is happening now with the coronavirus rollout. In just the first 4 months of this year, the U.S. government has recorded more deaths after COVID vaccinations than from all other vaccines administered in the United States between mid-1997 and the end of 2013. That is a period of 15 and a half years. Again, more people, according to VAERS, have died after getting the shot in 4 months during a single vaccination campaign than from all other vaccines combined over more than a decade and a half. Chart that out. It's a stunning picture. Now, the debate is over what it means. Again, there's a lot of criticism of the reporting system. Some people say, well, it's just a coincidence that someone gets a shot and then dies, possibly from other causes. No one really knows is the truth. We spoke to one physician today who actively treats COVID patients. He described what we're seeing now as the single deadliest mass vaccination event in modern history. Whatever is causing it, it is happening as we speak. So you'd think that someone in authority might want to know what it is, what's going on. If the vaccine injury reporting system is flawed, and clearly it is flawed, why hasn't it been fixed? And more to the point, why has there not been an independent vaccine safety board impaneled to assess what is happening and reassure people who stumble across official government numbers on the internet? But amazingly, none of that has been done. No one even mentions the numbers. And in fact, you're not allowed to. You'll be pulled off the internet if you do. The people in charge do not acknowledge them. Instead, they warn us about what might happen if we don't take the vaccine. Here's Joe Biden.
You know, there's a lot of misinformation out there, but there's one fact I want every American to know. People who are not fully vaccinated can still die every day from COVID-19. This is your choice. It's life and death.
People who are not fully vaccinated can still die every day from COVID-19, Joe Biden said. And as a factual matter, that is true. But it is also misleading. Not all Americans are at similar risk of dying from COVID-19. Some are at relatively high risk, the old and the sick. They might want to get vaccinated, most do. Some are at very low risk of dying, the young and the healthy. Others appear to be at essentially no risk at all. That would include anyone who's had COVID and recovered. Virtually all of those people seem to be immune. And that's true for many viruses. So those second two categories, the young and the healthy and the previously infected, may add up, if you combine them, to hundreds of millions of people in this country. The funny thing is the White House, the official policymakers who are designing the vaccine rollout, do not acknowledge that those categories even exist. Health authorities are pretending that everyone's health and risk potential is exactly the same as everyone else's. And that's why Joe Biden has demanded that 70% of all American adults, regardless of age, regardless of health condition, regardless, critically, of pre-existing antibodies from previous infections, get the COVID shot by the 4th of July 2 months from now, or else. Now, this might be an acceptable policy. It would never be an ethical policy, but as a practical matter, it might be acceptable to the country if COVID vaccines, we could show conclusively, came with no risk. And if we truly understood the long-term effects of those vaccines. But neither one of those things is true. We know that according to the government reporting system, thousands of people have died after getting the shot. That is true in this country, where it's hotly debated, when it's talked about at all, but it's also true in European countries, whose record keeping on this question is, if anything, more reliable than ours. Many thousands of other people appear to have been injured after getting the vaccination. VAERS records nearly 900 non-fatal heart attacks in people who just received the shot. 2,700 people reported unexplained chest pains. In all, the vaccine, according to the government reporting system, appears to have contributed to at least 8,000 hospitalizations. Some of the side effects defy easy explanation. Researcher Alex Berenson has noted that coronavirus vaccines now account for almost 1/3 of all tinnitus reports in the VAERS database. Tinnitus, the ringing in your ears. The American Tinnitus Association says it has received many questions on that link. It's still not known if there is a link, but there's concern about it. Meanwhile, researchers at Oxford and UCLA have begun tracking coronavirus vaccine side effects